Adventist Healthcare and You podcast. I am Shanna, joined with Nimit. Hi, Nimit.
Hi, Shanna.
I want to welcome everybody to a new year. This is our first podcast of the new year, and we're excited to welcome new guests and dig deeper into health topics. As we start this new year, we may have some new listeners, so I want to take some time to introduce you to the podcast and who we are. So the Adventist Healthcare and You podcast is a podcast all about health, making it more relatable, easier. Healthcare is very hard to navigate. And so we like to talk about health topics and make it easy for everybody to understand. So we hope that you enjoy it. As I said, I'm Shanna. I'm one of the hosts. I work at Adventist Healthcare. I've been with the organization for 9 years, and it's been a wonderful organization to be a part of. Nimit used to be a nurse at Shady Grove Medical Center. So thanks for sticking with this new podcast, Nimit, into the new year.
Yeah, no, I'm definitely excited for the new year. I think last year, it was great to have multiple podcasts on different topics. I think healthcare is such a complicated world, and, it's so hard for people to navigate it. And I think we did such a good job trying to, make it easier for our listeners and just everyday people how to navigate the healthcare system and where to ask questions and what questions to ask.
And that's our goal, to make healthcare easier. Today, we have a new guest, Dr. Adrian Dyer. Welcome, Dr. Dyer.
Thank you for having me, Shanna. It's nice to be here.
You're welcome. We're excited to have you. You are a family medicine physician with Adventist Medical Group, practicing out of our Colesville Road office in Silver Spring. You take a whole person view of patients in your care. You believe that by getting to know each patient beyond their symptoms and medications, you can better tailor treatment to their needs and preferences. So welcome.
Thank you.
Because this is the first podcast of the new year, we are going to talk about how we can be healthier at the start of this new year. Many of us make resolutions, and I thought it would be nice if we all shared if we made any resolutions. So I will let Nimit start. Do you have any resolutions?
Yeah, last year my resolution was, I think it's a typical resolution, be healthier and go to the gym more, maybe do more walks outside. This year I wanted to focus more on the mental health aspect of it, trying to make sure I spend more time with the family and ensure that I'm giving my time out of work as well. I think that's one of the things past COVID or during COVID that many people are not focusing on. So I think my resolution is to just have a better work-life balance.
Thank you. Dr. Dyer, did you make any resolutions?
I think for me, it's definitely getting out a little more. I've spent so much time indoors. I want to go out, explore the DMV region, and just maybe try to conquer my fear of roller coasters as a secondary resolution, but we'll see.
You have fun resolutions. I like that. Well, if you need a partner on the roller coasters, I volunteer.
I was just going to say that if you need somebody to go to roller coaster with you, I'm all about that.
I will hold your hand all the way through.
What about you, Shanna?
I've always read over these last few years that making resolutions don't work. Like you make these, you make these unattainable resolutions, and they're very hard to keep. And so I really liked yours because they seem to be attainable and they're not these big, huge mountains to climb. And so I try to make my resolutions simple or easier to manage. And so for me, my resolution this year is to be more active. However I manage to do that, I need to be more active. I've heard other doctors in the past, small steps. So I'm trying to be very aware of the small steps. So my resolution this year is to just be more active. I don't want to put any pressure on myself of I need to be active 30 minutes a day, an hour a day. I just really want to just focus on just being more active. So that's for me. Is what
That's great. I think it's very low key. I think it just needs to be realistic.
Dr. Dyer, when you see patients at the start of the new year, do you have a recommendation on a best way to make goals and keep them? Is that something you talk about with your patients?
Yeah, I think what you mentioned with regards to the small steps, it's just so important to take it little by little because it's way too hard to just go from 0 to 60 when you haven't done it in quite a while, especially if it's something like increasing one's activity, right? So I usually tell my patients, if you're going to start out, don't start out with 30-minute walk every single day. Just start out with 10 minutes every other day. Maybe next week do 15 minutes. Maybe if you don't feel ready to go for the 15 minutes, go back, take a step back, go back to the 10 minutes every other day and get yourself to a goal. Propose a goal. Maybe by the summer, I'll do half an hour every other day. And that's fine. It doesn't have to be all accomplished in a set amount of time. This is not a race, I tell my patients. So it's a good way to not overwhelm oneself.
I like that. Health changes can be overwhelming because oftentimes they're lifestyle changes. And those are so ingrained in us that it's hard to make big changes. It's overwhelming. I like this. Stick with the small stuff at first.
I like the fact that we could step back too. We don't have to do 30 minutes. If we do 30 minutes one day, but the next step we can at least do 15 minutes. And, doing little is not a bad thing either. What are some of the health commitments people can make this year that are easy for them?
Keeping in mind that you can schedule just your annual physical or just your checkup on a yearly basis to see where you stand, with comparison to the previous year. A lot of health screenings, they change with the seasons, I say, because doctors come up with new evidence every single year. So our guidelines also change with those recommendations. Take, for example, in March of 2021, we changed our screening for lung cancer. We used to tell people, if you were a tobacco smoker, there's really no evidence to suggest that we should do an annual lung scan to check for cancer. However, those guidelines changed back then, and now we actually do tailor the recommendations that we built up over the years into doing a yearly lung scan for very specific people who have that history of tobacco smoking. Later on that same year, over in May of 2021, we changed our recommendations with regards to colon cancer screening. We used to say, do it at the age of 50, but now we start to realize maybe we start a little earlier and catch people early on. So we switch those recommendations to the age of 45.
Okay. Make that annual physical so that you catch any new screenings that you might need.
Right. Just because we can change those recommendations from one year to the next. And I don't mean to say that we don't like to stick to guidelines. I just say that they change over time, with our new knowledge.
That's a good thing. I know I need to make my annual physical, so that's a good one.
And I think that's one of the things I heard in previous listeners too, where guidelines change so often. And I think just having that conversation with your primary care provider during your regular visits, just to ensure that you know what the current guidelines are and you're following that, because data changes all the time, new research comes along, and we want to make sure that people know the most accurate information and have an avenue for it too.
Absolutely. And you even hear from some patients some new guidelines that popped up, that they see a commercial somewhere, they see on a magazine somewhere, hey, ask your doctor about X, Y, or Z screening. And your doctors themselves can actually learn a few things from the patients when they bring those things up.
That's such an interesting comment, Dr. Dyer. I was talking with a friend the other day. We were talking about asking Dr. Google, if you're not feeling well and how is it when patients come and they say, I Googled this or I saw this commercial. And I said, I'm sure that it's hard sometimes, but then other times it's good to be your own advocate. So I like what you said, that that's a time where you're having a conversation with your physician. So if you see or hear something, it's good to bring it up.
Absolutely. Because not only do guidelines change, but patients really, really should advocate for themselves. We don't know everything. And sometimes we learn a lot from our patients.
That's great. Nimit, one of your resolutions was mental health. Dr. Dyer, we know it's just as important as physical health. So what are some ways people can do to improve their mental health this year?
I think that's where I stole a little page from Marie Kondo's book. Just find the things you find joy in. If they bring you joy, then spend more time doing those things. Your children, your family, going out for walks. If that brings you joy, do more of it.
That's good. Just do more of what makes you happy. Don't.
Yeah, I think trying to be purposeful would be beneficial too. Just being purposeful on the walks, going out in the nature, or going to the gym, whatever makes you happy, but being purposeful about it. I think that's my goal, at least for this year, to make a better work-life balance or improve my mental health for sure.
Yeah, I like that. Well, thank you, Dr. Dyer, for coming on and sharing your tips for getting off to a good start to the year for your health. And thank you to our listeners that started with us last year. We're grateful to you, and we hope that what we have shared is helpful. And we're excited for the new year, new topics, new listeners. If you haven't subscribed to us yet, please follow us to get new episodes. And if you'd like to find Dr. Dyer and learn more about him, check out adventisthealthcare.com and search Find a Doctor. And thank you to everyone. Thank you, Nimit. And I hope everything's going well with the new baby.
Yes, it's going great.
All right. Well, thank you, everybody, and Happy New Year.